Data has it that at the age of between 9 and 18 months, only about 10% of our children in that age are well fed.
Children's nutritional status is a reflection of their overall health, especially children like these ones under the age of 5. Nutrition is of the view that it's not about the quantity of food these children take, but about the quality of food. It is lunch time for the Diogoras family, and the children are rallying around to say that this chore is done. Beans is the meal, which is very proteinous. The good thing here is that Grace Dogara and her neighbors are never mindful of their children's preferences, but eating healthy, even when more than half of these children prefer rice or noodles, which is a carbohydrate.
Like this, even the indomie, if you cook indomie, if you didn't put carrot, green beans, all these kind of things, the indomie will not work according to how it's supposed to be.
We are supposed to give them food like nutrients.
It is believed that malnutrition exists even among the rich. Malnutrition is not only about being underweight, stunted or too thin. It also deals with being overweight. From conception to 2 years is a critical period in the development process of a child, popularly referred to as 1,000 days window of opportunity. A recent report from the United Nations Children's Fund, UNICEF, says malnutrition is higher in northern Nigeria than in other parts of the country. Poverty, ignorance and traditional beliefs have been attributed to be the cause of the high prevalence rates.
Beginning years, more children were still dying. There was a lot of children who were lost during the program, and we've seen over the years that those numbers have become smaller and smaller.
Experts say the Nigerian government is collaborating with development partners to save as many as possible who fall under the malnutrition chart through a community-based management for acute malnutrition, CMAM. Just like what is happening in this CMAM site in Kano State, where malnourished children are fed with pumping nuts. A malnourished child is likely to grow into an unhealthy and less productive adult. To keep a child from getting malnourished is a two-way thing. This is where maternal nutrition comes in. Advocacy is in ensuring that women of childbearing age and children are fortified with the 5 important nutrients of vitamin A, iodine, iron, folic acid and zinc.
Complementary food. Complementary food, again, doesn't necessarily mean you have to spend money buying the commercial complementary food. Rather, it is feeding the child on available foodstuff that are made into paste and pudding in a consistency that is suited for the child. What is important at that stage is the consistency of the food and the frequency of feeding, as well as the composition of the food.
For these children who represent millions of others, they need to be protected from coming down with malnutrition in order to reach their full potential. In Abuja, Aisha Oba Ali, NTA News.